Hi everyone. Today is January 6th, 2026. And if the algorithm brought you here, welcome to Physician Heal Thyself, my January 6th episode. This is a little podcast video series that I started at the beginning of the year to kind of help me navigate my feelings and anxieties as a general surgery resident. I decided to start this and do one series a day, one video a day, about just things that happen over the course of the day and what I think about different things. So yesterday I was on night shift. I started the year of 2026 on night shift, and yesterday was my second night shift. If you watch the first episode after my first night shift, I said that it was a pretty uneventful evening. Yesterday was not uneventful. It wasn't terribly exciting, so to speak. It was just very busy. I think that's one of the things about the night shift, that sometimes you can go and all the patients are tucked in and everything's really good and you have kind of a nice evening. And then sometimes you go and everyone wants everything. And because you're covering a bunch of services, sometimes there's just so much to juggle. And then you get consults, new patients coming in from the ED, people that are on the floor that want to be seen for one reason or another, or that need to be seen for one reason or another. Or you have just like a patient that would not rest, that wouldn't go to sleep, that, is just challenging for nurses, challenging for you. That was kind of my night yesterday. My immediate senior wasn't doing very well, and so they called out they weren't feeling well. So it was myself and our chief. And one of the things, first of all, out of yesterday that I think I'm really grateful for, especially with the program that I'm in, is how much support you get from people, from seniors, from your chiefs and things like that. Last night with my chief, I was really, while I was running around doing like random little floor things, and getting kind of hijacked by patients, my chief was in the background, helping out, cleaning up different things, going to see different consults, or just updating our document that we have that we pass out in the morning. And it always makes me feel really supported. It always makes me feel really good. And I always think about the people who are ahead of us, who do these things, who deep dive into patients' charts and find information that we can't find, who can read, scans and things like that better than we can, who can multitask really easily and put all of these things together. And I always think that that's the kind of resident, the kind of chief, the kind of senior that I would like to be. And hopefully as the years are going by, I will learn how to do that. I mean, as an intern, what do I know? But there are little different things that I pick up either by just watching or by just listening, or really asking the question. Like yesterday, my chief wanted me to find this particular medication for this patient that they take while they're at home. And I was looking in the places that I always look into, and I can't find it. I don't know. Where are you looking? And so they pointed it out and they were like, okay, if you click on here and you go here and you go here, this is where you're going to locate it. And I always think it's really helpful. And just, especially with being a new resident, and I know we've been in 6 months and things like that, but with different rotations, different things change, and nights is one of those times when because there's not a lot of people, there are not a lot of resources that are available overnight. It's always nice to have somebody, especially a senior, that really, supports you. There's a stark difference between people that are there and that are helpful and people that are not necessarily helpful. And I've been fortunate to not have many not necessarily helpful seniors. I think it's a great thing to have. I think it's a great thing to aspire to be as a resident. The other thing that I wanted to talk about, just from my own like learning standpoint about last night, is something that always breaks my heart is when patients come into the hospital who are younger than me, who have just medical conditions that I can't understand. Like people that come in, and it always, of course, if you see somebody that's your age that comes in with something, say like a cancer or something like that, especially the people that come in that where the cancer's already in advanced stages, or they have these like, either congenital conditions that they carry into adulthood, or just something that started from nowhere. Like in the past month and a half or so, I have participated like in the care of a patient that was my age who had stage 4 colorectal cancer, a patient that was my younger sister's age who had just this like spontaneous like kidney failure and is currently on dialysis, and and has a whole bunch of other things going on, and then their patient that came in yesterday that just had like an interesting just general picture that we couldn't understand, I couldn't understand, and it was something, according to the patient's family member, that just started about 3 years ago, and they have no idea what happened. And it always makes me feel really sad, but also, it makes you think about yourself, and one, how privileged and how blessed I am to have relatively good health, to be in a position where I can just do the things that I want to do. But it also makes me think about, all these different things, especially with the colorectal cancer. I think the one with colorectal cancer always strikes me because in the last probably 6 months, I've either heard or have met people who are less than 40 years old. And I say 40 because 40 is usually like where they tell you to start doing like colorectal screening, with the colonoscopies and things like that. But there have been people that are younger, and the people of the Cameroonian community in the diaspora will probably know a little bit about this. But last year there was a Cameroonian girl who, like, I think she was 32 at the time of her passing, but when she was 30, while she was in the process of her first pregnancy, found out that she had advanced stage colorectal cancer at the age of 30. And one of my last episodes, I talked about us being, really up to date on our medical histories. But for some of us, for people like us who come from countries like Cameroon, who come from African countries where we don't follow genetics so much, we don't follow family history so much, my grandparents on my dad's side, just in conversation, especially now as a medical person, just in conversation with my parents, my dad, their family members, I know that both my grandparents on my father's side passed away from cancer. I have a relative who is close enough to be first degree, who had cancer, and I'm now at the age where if we knew what that history was, I would have to start looking into different things. Now, I don't know what kind of cancers they were. Everybody that we talked about, like, just speculates what they are. But it's one of those things that, especially when we see that younger and younger people are getting diagnosed with these, like, advanced stage cancers, I always wonder what we could do, because you can't just run around screening everybody at any time. Like, that's not what screening tests are for. But I often wonder, especially personally, especially knowing that there's some history of cancer in my family, especially knowing that there's some history of, like, those kinds of things that could be passed down. I often wonder where the cutoff is, where to start. And there are guidelines Like if you are aware that you are a high risk person, there are guidelines that you can have. But I don't know, for me, like who never actually had the proper information, I'm not entirely sure if it makes any sense to go and down or like screening rabbit hole for different things. But it always makes me really sad to see people coming in at times like this. Especially, I keep bringing back colorectal cancer because like colorectal cancer is cancer of the colon. If it's caught early, the thing that you can go and do is you chop out the parts of the colon that are bad, and then hopefully that person doesn't have cancer anymore. But it's also something that it's very asymptomatic, like you don't have symptoms until it's too late. So it's hard to navigate, it's hard to do all of that. And just with all those other conditions, it's just hard to see people that show up that, I think about my sisters and I think about like what they're doing with their lives right now, having jobs, meeting people, getting married. And I see these people in the hospital and it's it's hard. It's hard to watch. It's hard to navigate. And again, things that I get out of it is just gratitude. Gratitude for having the health that I have, for having the body that I have, for, having the ability to do things like go to the gym, because there are people that would like to exercise, but they don't have access. There are people that would like to eat healthy, but they don't have, the means. So more than anything, it just provides me with like a means of gratitude, a space to sit with myself and say that there are things in my life that I can't take for granted. I can't take my health for granted. I can't take, my family for granted. I can't take this job that I have for granted. So last night was really busy. I'm going to try to keep this under 15 minutes because my other couple of videos have been a little long, but last night was a good night for just also figuring out like how I would navigate a situation, because I'm 6 months away from being a second year. Responsibilities are going to start like increasing, and I have to figure out how to be more efficient, how to be on top of my game, how to do all of those things. And I'm usually, as stressful as they are, as overwhelming sometimes as they are, I'm usually grateful for nights like these because they give me an opportunity to see the things that I need to work on. Something that I got out from yesterday is that I do all of the tasks, but then with everything you have to document. It's a documentation that always holds me. And it was like 4:30 yesterday and I had these notes and I was trying to put all of them in, and then I had to go do other things for other patients, and that was my big takeaway from yesterday, is that I need to figure out how to get a task, take care of it, do my documentation, keep going. Get a task, take care of it, do my documentation, keep going. Sometimes it's really hard. Sometimes those things pile up because, like I said, nurses are asking you questions from everywhere. You have to run and put NG tubes in people, and then you have to, figure out why this person isn't taking their medication, or like why this person wants more Dilaudid or whatever. But still, there's something to be said for tailoring it down to efficiency. And I'm going to keep trying to figure out how to do that for these next 6 months so that I can be ready for when second year comes and I have more responsibility. If you have gotten this far, thank you for listening. Thank you for watching. Thank you for being my anonymous therapist. And I hope you have an excellent Tuesday. I hope you have a good rest of your day, your work day, your hang around at home day, your whatever it is that you do with your day. And see you all tomorrow.